Good morning, everyone, and welcome to this joyous occasion. The joy is already evident. The 30th annual White Coat Ceremony at the University of Illinois College of Medicine. I am Dr. Raymond Curry, and I have the honor of serving the college as Senior Associate Dean for Educational Affairs. We've spent the week welcoming the entering class to the University of Illinois in the College of Medicine and to the profession of medicine. They've met their first faculty advisors and mentors. They've met the dedicated staff who serve our students. They've interacted with patients for the first time as medical students. And perhaps most importantly, they've begun to know one another. And now to conclude the week's activities, it's my great pleasure to begin this ceremony, a ritual that has become a treasured event at many medical schools around the country. And before we begin, I'd like to recognize the members of our platform party. First, the Chancellor of the University of Illinois Chicago, Dr. Marlin Miranda. Our Vice Chancellor for Health Affairs, Dr. Robert Barish. The Executive Dean of the College of Medicine, Dr. Mark Rosenblatt. Our keynote speaker today, Dr. Sarah Mesmer. Senior Associate Dean of Students, Dr. Kathleen Kashima. The Associate Dean for Undergraduate Medical Education, Dr. Heather Hyman. The Associate Dean for Admissions, Dr. Trevon Thompson. And the Assistant Dean for Admission, Stacy Walters. Those I've introduced so far have college-wide roles. That is, their responsibilities extend to the Peoria and Rockford campuses as well as the Chicago campus. Next, I'll introduce those members of the platform party who are part of Chicago campus administration. Our Associate Dean for Medical Education, Dr. Amanda Osta. The Assistant Dean for Student Affairs, Dr. Claudia Boucher-Berry. The Assistant Dean for Advising and Career Planning, Dr. Charlie Nburabun. Assistant Dean for the Phase 1 curriculum, Dr. Amy Lin. And the Gold Humanism Honor Society faculty advisors, Dr. Sean Blitzstein and Dr. Mamuna Hasnain, who is also Associate Dean for Faculty Development. Several of the prominent faculty members who serve as the students' physician house advisors are here today, and they will be assisting their students as they don their white coats. Dr. Bernice Mann, Dr. Lauren Williams, Dr. Vidya Govint, Dr. Gina Walton, Dr. Lilach Rothschild, Dr. Emily Graber, Dr. Nicole Thompson, and Dr. Michael Charles. Then I also want to take a moment to recognize and welcome all of the family and friends of our new students, as well as those who are joining us via live stream. We're really thrilled to have you all here with us today. And in the spirit of healing and of building a better future, I'd like to take a few moments to acknowledge that UIC resides on the traditional territories of the three Fire peoples, the Ojibwe, the Odawa, and the Potawatomi. This area was also a site of trade, gathering, and healing for more than a dozen other native tribes. And what's more, the state of Illinois is currently home to more than 75,000 tribal members, such that the Chicagoland area is currently home to one of the largest and most diverse urban native communities in the US. We recognize that indigenous peoples are the traditional stewards of the land that we now occupy, living here long before Chicago was a city, and still thriving here today. And as we work together today on these territories and in the year ahead, we must remember our responsibility especially as a land-grant university, an Asian American, Native American, Pacific Islander serving institution, a Hispanic serving institution, and a minority serving institution, to find ways to right the historic wrongs of colonization and state violence, and to build bridges with and support indigenous community struggles for self-determination and sovereignty. Now a word about the white coat ceremony tradition itself. The white coat ceremonies were started by the Arnold P. Gold Foundation in 1993 as a way to emphasize humanism in medicine from the very start of one's medical education. This emphasis on humanism in medicine is exemplified in our Gold Humanism Honor Society, or GHHS, and its members. GHHS members are fourth-year students who have shown themselves to be exemplars of humanistic patient care. The students given this honor are selected by a committee based upon their demonstrated excellence in humanistic clinical care, leadership, compassion, and dedication to service, and chosen with input from faculty and from student peers. The pin that will be provided to you today is the Gold Foundation's Humanism in Medicine pin, and you can wear this on your white coat as a symbol of your aspiration to demonstrate these qualities yourselves on a day-to-day basis. Now, I'm pleased to introduce the Chancellor of the University of Illinois Chicago, Dr. Mary Lynn Miranda. Dr. Miranda took office as the 10th Chancellor of the University of Illinois Chicago in July of 2023. She's an international leader in the field of geospatial health informatics, with a focus on childhood environmental health, and as such, she holds a faculty appointment in our College of Medicine in the Department of Pediatrics, as well as an appointment in the Department of Mathematics, Statistics, and Computer Science in the College of Liberal Arts and Sciences. Dr. Miranda is a Phi Beta Kappa summa cum laude graduate of Duke University, where she earned a bachelor's in mathematics and economics and was named a Truman Scholar. She has a PhD from Harvard University, where she held a National Science Foundation Graduate Research Fellowship. She's a fellow of the American Association for the Advancement of Science. And as our Chancellor, Dr. Miranda is deeply committed to the role of UIC in shaping Chicago, the state of Illinois, and the world. In recognition of these commitments in 2023, she was recognized by Crane's Business Chicago as a woman of note. Please welcome her to the podium for some comments.
Thank you so much, Dr. Curry, for that very warm introduction. I would have been okay with the Chancellor and leaving it at that. So I feel so much joy to be in this room with all of you, and I feel so much pride as the Chancellor of the University of Illinois Chicago to look down on this sea of faces that is making the decision to commit your life to the pursuit of medicine and the pursuit of caring for people and healing people. As Dr. Curry mentioned, I do work in children's environmental health, and for a long time, and to this day, I do a lot of work on endocrine active compounds and how endocrine active compounds might affect pregnancy and early childhood. And as a consequence of that, even though I'm a PhD and not an MD, I had to do this very deep dive on fetal development, what are things going on during pregnancy, and learn an enormous amount about this complexity of forces that are operating in a woman's body when she is preparing to become pregnant, becoming pregnant, is pregnant, and then delivers, right? It's and the deeper you go into the intricacies, I remember remarking to my husband that it's a miracle that anyone gets pregnant at all because of all these things that have to go right. And I did all this work on endocrine active compounds, and then one of the things that became apparent to me as, and a lot of it was very community engaged work, is that as much as that the basic biology of what was going on in pregnancy and those environmental exposures were important, we needed to locate these pregnant women within the communities, locate and understand pregnancy and pregnancy outcomes and child outcomes within the context of the neighborhoods and communities in which they live. So continue to do a lot of work on the social and environmental drivers of health, where all of these things that happen during pregnancy, it's not enough to get it to a good outcome immediately after pregnancy. There are all of these things that have to happen for a child to reach their full potential, for a family to be able to care for that child in the way they want to care for that child. So all this work on environmental exposures, all this work on social and environmental drivers of health, and then I got pregnant myself, right? So my husband and I started having children. As I said, it seemed like a minor miracle that anybody could get pregnant. And in the process of being pregnant myself, one of the things that I realized for the first time in this, not just in my head, but all the way through all of the molecules in my body, is the incredible strength that I had, that my body had as a pregnant woman, and all the power that I felt. So my husband is much more athletic than I am, and that's sort of a standing joke in the family. But I get to say, I grew 3 human beings inside me, and you never did anything as amazing as that. Yeah. And they all turned out pretty good. So I had my own pregnancy and realized all the things that my body was doing in response to little perturbation, that the community of people who were supporting me were doing to help me get through everything. So that was my own pregnancy, and now one of my children is pregnant. So I'm about to have my first grandchild. And I see in her that incredible strength and power of her own body and of the community that is supporting her to make sure that we get to a good outcome for the baby. So why am I talking about all of this like weird stuff about my research and personal stuff about my pregnancies and telling you that my daughter's pregnant? A lot of people just learned that for the first time. She happens to be visiting me this weekend, and she's in the audience. Hope you're okay with that, darling. So the reason that I'm talking about things, this is actually a message directly for all of you who are about to don your white coats. So there's this body with all of these things, like when the inflammatory cascade starts, there are things that happen in your body that help stop it. When your stress response pathway gets activated, there are things in your body that help stop it. There are also people in your community that help stop those things, right? So you have here this village, all these people sitting in the audience, you have here this village who has been wishing you to this point, loving you to this point. And I want to just take a moment to say thank you to this village and encourage all of you to turn and say thank you to your village who's here. I also want to make the point and hope that all of you understand that you have another village now, and that village is the University of Illinois, Chicago. These faculty who are on the stage with me, everybody here on this campus, whether you're talking about the nurses in the hospital where you do rotations, whether you're talking about the groundskeepers, whether you're talking about faculty or staff, all of them want you to succeed. Because this is a place that believes so very deeply in our mission to provide the broadest access to the highest levels of educational research and clinical excellence. So I want you to know that you have another village. The second reason why I talked about all of this stuff is it's important for you to realize, especially as you're entering the medical profession, that you are instantly becoming part of a lot of other people's village. So your fellow students in your class, the other students in the College of Medicine, but every patient you interact with, every staff person you interact with, every human being you interact with, whether at the grocery store or the pharmacy or the gym, whatever, you, in some small or large way, are part of their village. And you can be the difference, especially as physicians, you can be the difference between things sort of careening out of control for people or helping to make people feel that they can get through things, that things will be better. And it's each of your interactions. It's really hard when you're having a hard day to not be your best self, but when you come into this world of becoming a physician, you really need to find ways to be your best self, especially whenever you're interacting with our patients. So remember, you have a village, you have another village, and you are other people's village. So I'll just conclude by saying, if you will allow me, I feel so much pride in all of you. I know I'm only meeting some of you for the first time, but I feel so much pride. Secondly, I feel so much joy to be here, and I hope that you feel the joy that everybody in this room has experienced over the fact that you have reached this amazing point. And the third thing I want to say is that I feel so much love. I feel so much love from the people who are here to support you. I feel so much love from all of you for your decision to make a commitment to this profession. That's a commitment of love. And I feel so much love personally for all of you that you are willing to take up our mission here at UIC to think about access and excellence at scale and serving others and serving people who do not necessarily get the attention that we know that they deserve. Because here at UIC, we believe that everyone deserves world-class care, and you are going to be part of delivering on that mission for us. So congratulations to all of you.
Thank you so much for those comments. You did deserve that introduction. In fact, it's only a fraction of what we could have said. And I'm thinking maybe, let's make a note, Jody, for next year to add that she's a grandmother. Congratulations. So next, let me introduce the Vice Chancellor for Health Affairs at the University of Illinois Chicago, Dr. Robert Barish. Flip the pages. Dr. Barish is a distinguished physician and academic leader dedicated to the pursuit of health equity. He oversees UIC's 7 health sciences colleges with campuses in Chicago, Peoria, the Quad Cities, Rockford, Springfield, and Urbana. And as the leader of the University of Illinois Hospital and Health Sciences System, or UI Health, he also leads a clinical enterprise that includes a tertiary care hospital, more than 40 outpatient clinics, including 11 mile-square health center locations, which are federally qualified health centers. In 2019, Dr. Barish received the William Cullen Bryant Award, the highest honor from his alma mater, the New York Medical College. He has served as the chair of the board of the Association of Academic Health Centers since 2020, and most recently in 2022, he was appointed to the board of directors for the Association of American Medical Colleges, the AAMC. Please join me in welcoming Vice Chancellor for Health Affairs, Dr. Robert Barish.
Okay. Thank you for that very kind introduction, Dr. Dean Curry. So to all our aspiring incoming medical students, their families and loved ones, greetings and congratulations. On behalf of UIC and its academic health enterprise, UI Health, I want to formally welcome you as you continue your education and training to become future leaders in medicine, research, and discovery. Coming from diverse backgrounds and experiences, each of you have already proven your commitment through hard work and considerable achievement. Each of you is certain to thrive and further discover your own passion for health and care delivery. Now, a white coat ceremony is one of my favorite events of the academic year. This event is symbolic and rich with tradition, You heard from Dean Curry that this ceremony began in 1993 at Columbia University College of Physicians and Surgeons and is celebrated at hundreds of professional medical schools in the United States. Now, they didn't have this ceremony when I entered medical school 49 years ago, 1975. So this is what you're going to look like almost 50 years later. So today's ceremony signifies the beginning of your journey to becoming physicians. The tradition of the white coat ceremony is much more than donning a new article of clothing. It signifies a change in your role during your training, and it reflects a promise to uphold professionalism and integrity in your profession. Throughout the ceremony today, you will hear much about service, community, professionalism, and humanism. Please take a moment to reflect upon the importance of this gesture of trust and confidence in each of you as you continue your education and training to become compassionate providers. Your journey to become a physician is not an easy endeavor, and by accepting the white coat, you are signifying that you are up for the challenge as you turn to clinical training. I am confident that our outstanding faculty will teach and support you along the way, while providing you with the framework necessary to develop into trusted professionals. With this in mind, always remember that your white coat is a symbol of trust and hope. Trust and hope. So as the future leaders in medicine, you are the guardians of dignity and integrity, respect and trust, safety, and ultimately providing compassionate patient care. So on behalf of the university and its academic health enterprise, I congratulate you on your journey to reach this moment, and we look forward to your continued growth and achievement in the years to come. Enjoy this special day. Thank you.
Thank you, Dr. Barish. And now, I would like to introduce our Executive Dean, Dr. Mark Rosenblatt, to deliver his welcome. Dr. Rosenblatt is the G. Stephen Irwin Executive Dean of the University of Illinois College of Medicine. He also serves as the CEO of the University of Illinois Hospitals and Clinics and as Distinguished Professor of Ophthalmology and Visual Sciences. Prior to becoming Executive Dean in 2019, Dr. Rosenblatt served the College of Medicine as head of the Department of Ophthalmology and Visual Sciences and as the director of the Medical Scientist Training Program, the MD-PhD combined program. Dr. Rosenblatt is an internationally recognized clinician scientist. As director of the Corneal Regenerative Medicine Laboratory, he leads groups of scientists investigating the mechanism of corneal peripheral nerve regeneration following injury and the use of nanoengineered biomaterials for use in stem cell delivery to the ocular surface. Dr. Rosenblatt is a graduate of the University of Miami Miller School of Medicine's honors program in medical education, the combined BA-MD type program, and the combined MD-PhD program. He completed his ophthalmology residency and combined clinical and research fellowship in corneal disease at the Massachusetts Eye and Ear Infirmary of Harvard Medical School. I'm pleased to welcome Dean Rosenblatt to the podium.
Thank you, Dean Curry, for that perhaps overly generous and certainly lengthy introduction. It's my utmost pleasure to welcome you all here, family members, friends, loved ones, and especially the University of Illinois College of Medicine class of 2028. A loud round of applause. We could not be more excited to welcome this incredible class into our college. As you all probably realize by now, if not before, you're entering one of the nation's largest, most diverse medical colleges. It's a special place where we take pride in providing an excellent medical education in an innovative and active learning environment. I can tell you that medical school will present you with some of your greatest challenges in life thus far, and also many of your greatest triumphs. There'll be times of laughter, times of sorrow, times when you shed tears, times of joy. Sometimes all of these emotions will happen in the span of 10 or 15 minutes as a medical student. But what's wonderful is you share these emotions, these accomplishments with your peers, and also with your patients and their families. I can assure you that every day will bring something new to you and your experience in the college. And today, we're here to celebrate a wonderful symbolic entry of you into the world of medicine through this white coat ceremony. Allow me to tell you just a little bit more about this coat and its uses. Of course, it's going to be used to protect your clothes. That sort of makes sense. You'll probably use it as a backpack. I know that my pockets as a medical student were always overflowing with all kinds of things. We won't talk about all the things that might have been in there. If it was raining, the white coat makes a great umbrella, keep you dry. And in those few moments, in the long days in the hospital, the long nights in the hospital, where you might have a chance to get a nap, you can fold up this white coat and it makes quite a nice pillow, I found. And frankly, some weeks your white coat won't be quite white at all. It'll be kind of dingy, but it will accompany you, a constant friend, a constant reminder from this day forward of what you are and what you will become. The white coat garners tremendous respect from patients and families, so we ask that you justify this respect and earn their trust. Remember, in many ways, this isn't really your white coat. This white coat has been handed down to you. The white coat that you're receiving today has been funded by donations from the College of Medicine's alumni. This is a tangible expression of our alumni community's enthusiasm about your very first step towards becoming a physician and furthering their work in the generations to come. We and they celebrate your entry into a profession in which you are so very clearly needed for patient care, research, teaching, and public health. The past several years, including, of course, the generational pandemic, have proved time and time again how much a difference physicians make in the lives of individual patients, but also in the communities that you will serve. I hope in the years to come, maybe 10 or 20 years from now, you will have the pleasure of welcoming incoming medical students with white coats of their own. So once again, congratulations on your acceptance into this noble and wonderful profession, and welcome to the University of Illinois College of Medicine. Welcome. I now have the privilege of introducing Dr. Sarah Messmer, this year's keynote speaker. Each year, a prominent member of the College of Medicine faculty, one who embodies the tenets of professionalism and humanism that we celebrate here today, delivers the keynote address. This year, Dr. Messmer, an amazing clinician scientist, has been selected for this very honor. Dr. Messmer is an assistant professor of clinical medicine and pediatrics and is triple boarded in addiction medicine, internal medicine, and pediatrics. That's a lot of training. She provides primary care for adults and children at UI Health, as well as low-threshold substance use disorder on Chicago's West Side, in a clinic developed with a long-standing syringe service program run by the UIC School of Public Health. Dr. Messmer is co-PI and clinical lead of the Mobile Medication-Assisted Recovery Program, which provides primary care and substance use treatment via a mobile van at overdose hotspots in Chicago. Dr. Messmer's research interests include opioid use disorder treatment in low-barrier settings, implementation science, community-engaged research, harm reduction, and development of curriculum to improve education for healthcare professionals on substance abuse use. Given her work and the extensive work in the community, Dr. Messmer was chosen the Gold Humanism Society Faculty of the Year in 2024 at the University of Illinois College of Medicine, and was one of our inaugural Physician House advisors. So we're very pleased to welcome Dr. Messmer as your keynote speaker today. Dr. Messmer.
Hi, everyone. Thank you for the introduction and for inviting me here today. It is an incredible honor to be here to celebrate this important milestone for all of you as you take the first step from being students to being physicians. I want to start out by saying congratulations and welcome to this incredible profession. I also want to acknowledge all the work you've done to get here, the sleepless nights, the extracurricular activities, the organic chemistry classes. You've worked so hard, and you deserve to celebrate today. And I know we did this before, but I also want to acknowledge all the people here with you, your family, friends, loved ones who've supported you to get you to this moment. Let's give them a round of applause. So it truly is an honor to be here as you receive your first white coats. Ironically, I almost never wear a white coat anymore. I'm a pediatrician and an internist, as you heard, who specializes in addiction medicine. In pediatrics, we don't wear white coats to minimize terrifying the toddlers. Instead, we often wear animal-shaped flashlights and dress up in costumes for holidays, so a little different. In my addiction medicine work, I see patients at a syringe service program and on a mobile unit as part of a harm reduction program. A lot of our patients have experienced trauma in healthcare settings, so I don't really wear my white coat in that setting either. But even without the physical white coat, the meaning behind it remains. You're now part of a profession that is more than just a job, it's a calling. It's a part of your identity and a core part of who you are. When I reflected on my own white coat ceremony, I remember feeling really excited but very overwhelmed. I felt like I hadn't done enough to earn a white coat, to earn the trust of patients when I did not know anything yet. And if you feel that way, don't worry. Know you deserve to be here and you will grow into your white coat over the next few years. So today, as I was thinking about what to share with you, I wanted to share just a few small things that have centered me throughout my medical training and practice today since I got my first white coat 15 years ago. So number one is gratitude. Medicine is really a beautiful profession. In your training, you will experience the vastness of the human experience. You will be invited into the most precious and heartbreaking moments. You'll deliver babies, you'll deliver bad news. You will hold the hand of your patient as they navigate the end of their life. You will walk with your patients on their path no matter where it leads. Your heart will be broken and rebuilt. Let it be. These moments are so powerful, and it is such an incredible privilege to be invited into them. It's not a privilege to be taken lightly, as I think you know. But after a while in medicine, it is easy to become desensitized to some things. You'll find yourself telling disgusting stories at the dinner table, completely unfazed, and anyone not in medicine will say, excuse me, we're eating. You'll be sitting in noon conference and you'll be eating your sandwich as people talk about eye infections, images and all, and it won't bother you. You'll develop the ability to keep a straight face no matter what's going on around you. And actually that's an important skill because someday you'll have a patient who is terrified to tell you something and you'll be able to just look them in the eye and say, seriously, I've seen it all, nothing you could do or say will surprise me. But as time passes, you cannot allow yourself to become desensitized to your patient's pain and humanity. What might be a normal Tuesday in clinic could be the worst day of someone's life, or the moment that changes everything for them. When I was in my third year of med school, I was on a busy internal medicine rotation, and I found myself working nights, admitting patients to the medicine service. At the time, I was very overwhelmed, and it would take me hours to write an admission note. I would labor over the details of the history, making sure not to leave out anything in fear of missing the important details. But when I was called to admit a new patient one night, I was going down the stairwell to the emergency room, and I thought to myself, this patient is going to teach you something that could change your life. It helped me recenter myself in gratitude, and it's remained true. Every single patient you see can teach you something if you let them. And I still remember the patient that I admitted that night, an older man with shortness of breath, and that lesson of gratitude that he taught me. So when you experience difficult moments, and you will, that's the time to turn to gratitude, to reflect on the privilege it is to be trusted with these moments in your patients' lives. Okay, moving on to number two. I have three total, so we're in the middle. Number two is listen to your patients. There's a quote you'll probably hear many times attributed to William Osler, although I don't know if he actually said it, but it's listen to your patient, they are telling you their diagnosis. And maybe that sounds obvious, right? Why wouldn't a doctor listen to their patients? But that's stuck with me over the years and it's become more profound as time goes on. Doctors are not always known for being great listeners. There was actually a study that found on average, doctors interrupt their patients after only 11 seconds. 11 seconds. It's not great. As a med student, you will have the unique opportunity to have more time than any other member of your medical team. Do not waste it in the workroom, spending 4 hours on an admission note, like I was saying earlier. Spend those moments at the bedside, listening. Learn about your patients' lives, their fears, their dreams. Meet their families. Play chess with that teenager who's admitted for chemo. Share book recommendations with the older patient on dialysis. Learn how to not interrupt your patients after 11 seconds. In fact, learn how to not interrupt them at all. So my favorite place to practice medicine currently is on our mobile unit where we do addiction medicine work. We work alongside a longstanding harm reduction program, the Community Outreach Intervention Projects, or COIP, which is run by the UIC School of Public Health. COIP has been providing services to people who use drugs for over 30 years in the community, and it's run by people with lived experience. So for the last few years, we've been able to bring a medical team out with the outreach team to meet patients where they are, literally, and offer whatever medical care they might be interested in. What I've been struck by is how many of our patients thank us just for listening and hearing their stories, for validating everything that they've gone through, for coming to their neighborhood and seeing them there. When you truly listen, you show respect, and you recognize the humanity in those that you care for. So listen, and your patients will not only show you their diagnosis, they'll show you what kind of doctor you want to be. Okay, number 3, this is my last one, is to challenge the system. When I was thinking about the most important message to offer you today, I couldn't help but think about the wisdom of Spider-Man. With great power comes great responsibility. You've probably all heard that one before. The white coat represents so many beautiful things about healing, the trust that our patients put in all of us, and that is you included when you walk into the room wearing your white coat. But it also does represent a medical system that often has paternalistic approaches to patient care, challenging power dynamics, and staggering health disparities. As you enter this profession and the medical system, recognize that you have a responsibility to change it, to make it better. We can't simply accept that when things are broken, that's the way they must be. We live in a country where, unfortunately, healthcare is not considered a human right, where the zip code where you live determines your life expectancy. There was a study from 2019 that looked at life expectancy based on zip code in cities across the US. And Chicago, where you all will be studying medicine for the next few years, was the city with the largest disparities. Residents in Streeterville were found to live to about age 90, and those in Englewood, just 9 miles away, lived to age 60. That is a difference of 30 years, and it is unacceptable. As I mentioned before, I work with people living with severe substance use disorder, often facing numerous barriers like housing insecurity, lack of transportation, isolation from family, and more. The challenges that our patients may face just to show up to our van are immense, but they show up. Working in harm reduction spaces has made me a better doctor. It's made me rethink how we practice medicine, what it truly means to meet people where they are. It's made me question who designs our healthcare system? Who is it designed to serve? I've heard countless stories from my patients about the stigma they face in healthcare settings, how they don't feel safe in emergency departments or clinics, places which arguably should feel like the safest place to go when you need help, how they've been called frequent flyers or denied care simply because they use drugs. We have to do better. So take lessons from the harm reductionists who I've learned from. There's a phrase often said in harm reduction spaces, which is, nothing about us without us. I challenge you to look around you and see whose voice is not at the table and find a way to bring it there. Build a new table if you have to. Challenge the system, work to build a better one, no matter what field you end up going into. And I know this may feel heavy, but the good news is you're not in this alone. You're part of this community here at UIC, also working towards these goals to address health disparities and improve the healthcare system for everyone. I have been very fortunate to find amazing colleagues here at UIC, in the College of Medicine, but throughout the whole university, to be honest. We build programs together that rethink the system and try to bring medicine to places where people may not be accessing it. And I'm excited for all of you to join this community and be part of the work as well. And speaking of community, as was mentioned before, you are all each other's community. So take a moment, look around you at your fellow classmates. They will become some of your closest friends, even if you don't know it yet. Lean on each other, learn from each other, support each other. Make sure that you take care of yourselves in this and each other as you walk through this journey together. So being here today, I feel so much hope, as has been said before. I feel it as well. As I see you all joining the profession. There's so much work to be done, as we talked about, but I know that you can do it. Your voices are so needed in medicine, and I'm excited to have you join our community at UIC. Good luck and congratulations.
Thank you so much, Dr. Mesmer. I somehow feel like you've distilled the collective wisdom of the faculty into a message that's perfect for the moment. Thank you. So, now for the main event. That you received this white coat today represents a public acknowledgement in the presence of family, friends, staff, and faculty that you recognize your obligations to the profession. For those in the audience that are not familiar with our approach at the college to mentoring and advising, each of our medical students is assigned to one of 8 College of Medicine communities, which we very intentionally and affectionately represent as capital COM for College of Medicine unities. And each of our students will receive their white coat alongside other members of their community by their physician house advisor or one of our clinical faculty in case that advisor was not available today. Now, these communities are named for notable faculty and alumni of the college, ranging from the 1890s to the 1980s. As evidence of the long history of our institutional commitment to diversity and inclusion, you will note that even among these earliest alumni, there were both women and people of color. These figures include pioneers in surgery, in women's health, in pharmacogenetics, in epidemiology, and public health, including one of the most influential people ever to serve as U.S. Surgeon General. We also recognize one whose potential was never fully realized, a stellar young physician scientist, teacher, and mentor of medical students whose career was cut short by HIV/AIDS in the early 1990s. So I now invite Dr. Heather Hyman, our Associate Dean for Undergraduate Medical Education, to come to the podium and begin to introduce our communities and announce the names of our students as they cross the stage to receive their white coat.
Thank you, Dean Curry. I don't deserve any applause, but I want to clarify that family and friends out there, you should feel free to cheer and celebrate as your student receives their white coat. We'll get a picture of them, and then we'll move on so that we do get a chance to celebrate afterwards, but you can cheer and clap. And students, when you exit the stage, we're going to ask that you sign the Professionalism in Medicine book containing a copy of the oath that you'll recite with us at the end of the ceremony. And by signing that book, you're agreeing to the standards of responsibility and trust that we've been hearing about from all of our speakers this morning. So we'll invite those in the handshaking party to come up to the stage and stay there. So Dr. Bernice Mann is a faculty physician in internal medicine, and she's the physician house advisor for the Jose Choca House. She will be bestowing the white coat on the students in the Choca House along with Dean Amy Lynn. Dr. Jose Ignacio Choca was born in 1959 in Havana, Cuba. After earning his bachelor's degree at Johns Hopkins University, Choca received both MD and PhD degrees from the University of Illinois College of Medicine. He took great pride in his work, helping minority medical students continue in school. His passion for research on sensory pathways and award-winning teaching continued despite learning that he was HIV positive in 1991. He died of complications of AIDS in 1994 at the age of 35. So I will now read the names of the students in the Choca House. Please feel free to joyfully applaud for your doctor-to-be. So we'll wait for the students to come to the stage. Mohammed Abdul Muqsit. Joshua Anatakai. Ishika Ashta. Chase Bednars. Sean Bergry. Brooke Brinkman. Claudia Campos. Kendrick Choi. Jane Clays. Shava Diani. Shira Hirsch. Sophia Kicks. Judith Kim. Abhishek Krishnan. Dan Marion. Clarissa Irene Molina. Megan O'Keefe. Saif Anbarji. Prarthana Prashanth. Kate Rao. Mariam Shaban. Amelia Smith. Nipun Velupali. Okay, congratulations to all the students in the Choka House. So Dr. Lauren Williams is a faculty physician in internal medicine and pediatrics and is the physician house advisor for the Rivers Frederick House. And she'll be bestowing the white coat on the students in the Frederick House along with Dean Inboroboon. In 1897, Dr. Rivers Frederick became the first African American to graduate from the Chicago College of Physicians and Surgeons, which today is known as UI College of Medicine, with a medical degree. In 1899, Frederick returned to Louisiana because he wanted to return to his place of birth and assist those in great need. Frederick joined the fewer than 50 Black physicians in Louisiana who cared for the state's Black population of 500,000. He played an instrumental role in the formation of the local NAACP branch and remained a life member. In 1934, Frederick became the first vice president of the National Medical Association. So I will now read the names of the students in the Frederick House. Pratibha Bulla. Rihanna Chaco. Adara Cross. Kirsten Drabeck. Preksha Garg. Sophia Giorgenti. Abigail Guillaume. Demetrius Harvell. Joseph Hutter. Jennifer John Brito. Yumin Kim. Rebecca Luft. Peter Mercurio. Brenda Obana Galvez. Juan Mateo Pinto. Aryan Shah. Marissa St. George. Krishna Thacker. Zara Firoz Vasi. Angelina Wilton. David Yu. William Zhang. Okay, big congratulations to all the students in the Frederick House. Dr. Vidya Govind is a faculty physician in pediatrics and is the physician house advisor for the Isabella Garnett House. Dr. Govind will be bestowing the white coats on the students in the Garnett House along with Dean Hasnain. On August 22nd, 1872, Isabella Garnett was born into the earliest African-American family to arrive in Evanston, Illinois. She worked as a school nurse for 2 years before enrolling in Chicago's College of Physicians and Surgeons, which is here, and obtaining her medical degree in 1901, at which point she was one of the first African-American women physicians in Illinois. Garnett practiced privately until 1914 when she and her husband opened the Evanston Sanitarium on the upper floors of their home. It was the first African American medical center north of the Chicago Loop. So I'm going to now read the students in the Garnett House. Abraham On. Sochibeze Akaneme. Amber Actor. Michael Allen. Niles Babin. Apurva Bamareddy. Sophie DeFries. Akash Gandhi. Alexander Gilbert. Anish Gudur. Jennifer Herrera. Jade Isaac. Sarah Kadera. Heidi Kim. Asta Kulshrestha. Sarah Nahan. Riya Patel. Tara Pavithran. Zion Philpotts. Ajit Venkatakrishnan. Christopher Vu. Yiru Jess Wong. Karis Wong. Okay, big round of applause for all the Garnett House students. Dr. Gina Walton is a physical medicine and rehabilitation physician, and she's the physician house advisor for the Olga Jonasson House. Dr. Walton will be bestowing the white coat on students in the Jonasson House along with Dr. Sean Blitzstein. Dr. Olga Jonasson was born in Peoria, Illinois. She was the child of Swedish immigrants. She finished her medical degree here at the University of Illinois in 1958. When she decided to apply for a surgical residency, there were very few women practicing in this area. She completed residency in 1964, followed by 3 fellowships, one of which was at Massachusetts General Hospital in transplantation immunobiology. She joined the faculty of the University of Illinois College of Medicine in 1967, where she developed the division of transplantation. She later, at The Ohio State University, became the first woman to head the Department of Surgery at a major academic medical center. So we now welcome the students who are joining the Jonasson House to the stage. Neda Abbassadeh. Caitlin Grace Barrett. Sarah Bergery. Bhavya Bhushan. Gav Brown. Cynthia Chin. Rachel Gao. Viviana Guerin. Julian Deshawn Johnson. Andy Jinpyo Kim. Lee Marino Klein. Christopher Martinez. Ethan Jude Miranda. Samer Muhareb. Catherine Knockham. Robin Palia. Ava Pellegrino. Stephanie Rodriguez. Sachi Shukla. Divya Sivarajan. Benjamin Smith. Hunter Nicole Smith. Andrea Marie Vavrenek. Mackenzie Vick. Congratulations to all the students in the Jonathan House. And I now welcome my colleague, Dr. Trevon Thompson, Associate Dean for Admissions and Recruitment, to the stage, where he will call up the students from the next 4 communities.
Thank you, Dean Hyman. The Metulski community. Dr. Lilach Rothschild is an anesthesiologist and the physician house advisor for the Arno Metulski House. Dr. Rothschild will be bestowing the white coats on the students in the Metulski House along with Dean Lynn. Arno Metulski was born in Germany to Jewish parents. He came to the United States in 1941 as a refugee from Nazi Germany after first being sent to an internment camp in Vichy, France. In 1944, he began medical school at the University of Illinois as a soldier, private first class. In 1957, he established a division of medical genetics at the University of Washington. There, he founded the field of pharmacogenetics. He mentored hundreds of fellows and students over 50 years, including 1985 Nobel Prize winner, Dr. Joseph Goldstein. We now welcome the students from the Metulski House to the stage. Aya Al-Baridi. Noor Al-Ghafir. Kiana Amini. Chidiabere Azubike. Sanjana Chandran. Kelly Duong. Allison Gregorian. Ana Carolina Hernandez. Christopher Edward Holden Wingate. Shruti Krishna. Ibrahim Lawal. Julia Lazareva. Dean Maldonado. Marin Monson. Shivam Patel. Richa Shah. Sarah Socha. Fatima Sumare. Rahul Vedakath. Angela Shu. Jennifer Zhao. Sage Zunner. Congratulations and welcome to the students in the Metulsky House. The Richmond community. Dr. Emily Graber is a family medicine physician and the physician house advisor for the Julius Richmond House. She will be bestowing the white coat on the students in the Richmond House along with Dean Imboraboon. Dr. Julius Richmond, a member of our class of 1939, was a towering figure in pediatrics and public health. During his internship and residency at Cook County Hospital, he witnessed the profound impact of poverty on child health. During his career as a faculty member, first here and later at what is now Upstate Medical Center in Syracuse, New York, he documented how poverty threatened the health and development of young children, presaging perhaps some of Chancellor Miranda's current work. As a federal official during the Kennedy and Johnson administrations, he founded the Head Start program and developed the concept of neighborhood health centers. In 1977, President Jimmy Carter appointed Richmond as the 12th Surgeon General of the United States and Assistant Secretary for Health. As Surgeon General, Richmond issued the Smoking and Health Report to advance life-saving public health change through tobacco control, as well as the landmark 1979 Public Policy Declaration entitled The Surgeon General's Report on Health Promotion and Disease Prevention. Now we welcome the students from the Richmond House to the stage. Ahmed Al-Najjar. Heather Birdsell. Ethan Boley. Julia Emily Boravkov. Olivia Diorio. Husseina Mustafa Electric Walla. Carol Guadalupe Flores. Kate Hartway. Hussein Hassanin. Catherine Johnson. Chanel Lee. Ross Matai. Michael Tiernan McHenry. Ushwati Nair. Preeti Navalpakam. Kale Patel. Josefina Pavez Berrios. Zach Root. Francesca Seaton Rosen. Samantha Rush. Young Chul So. Benny Schreier. Anne Zhang. Congratulations and welcome to the students in the Richmond House. The Sackett community. Dr. Nicole Thompson is an anesthesiologist and the physician house advisor for the David Sackett House and will be bestowing the white coats on the students in the Sackett House along with Dean Hasnain. David Sackett is considered a founder of the discipline of evidence-based medicine and was at the forefront of developing the medical education strategy of problem-based learning. After graduating from the University of Illinois College of Medicine in 1960, he became interested in how methods of epidemiology could be applied to healthcare questions about the diagnosis, prognosis, etiology, and treatment of clinical problems. Dr. Sackett created a graduate program to teach clinicians how to do healthcare research. In 1993, he became the first chair of the Cochrane Collaboration Steering Group. Dr. Nicole Thompson, we now welcome students from the Sackett House to the stage. Olivia Benson. Emma Bridgman. Isabel Brown. Colette Donlin. Arenzi Akoa. Benjamin Esquivel, Jr. Laura Hushmand. Matthew Huang. Ankush Kekt. Gabrielle Kendi. Nathaniel Matera. Sarah Grace Melendez. Rudolph Neustadt. Patrick Noon. Ugana Wakadu. Bianca Santos Declet. Gordon Sarah. Krishna Shah. Maitri Shah. Samantha Spritz. Kavya Sadir. Ayan Zafar. Congratulations and welcome to the students in the Sackett House. The house rivalry is already beginning, I see. All right, the Yaros community. Dr. Michael Charles, an internal medicine and pediatrics faculty, is the physician house advisor for the Rachel Yaros House. Dr. Charles will be bestowing the white coats on the students in the Yaros House along with Dr. Sean Blitzstein. Rachel Yaros immigrated to the United States from Russia as a teenager. In the US, she worked in a sweatshop before enrolling in as the first woman to enter the College of Physicians and Surgeons in Boston. Yaros spent the next 40 years on our faculty at the University of Illinois College of Medicine in Women's Health. She was a resident of the Hull House, the famous social settlement that nurtured leaders in social welfare. She was a leader in the birth control movement, and she challenged the attitudes, policies, and practices that denied women access to birth control information and devices. She established the first birth control clinics throughout the city of Chicago. She was a dedicated campaigner for sex education for women. By 1930, Chicago had 8 birth control clinics throughout the city, more than any other American city. I now welcome the Yarrow students to the stage. Elise Albertson. Asta Asim. Sufyan Mirza Beg. Alexander Boskov. Destiny Brittany Sasha Burnett. Caroline Caputo. Niels Dawson. Ashley Diaz. Lydia Eisenbeis. Brendan Hickey. Youssef Ben Ilyas. Susan John. Rob Kirshen. Ryan Kong. Cavell Means. Ryan Millman. Kaylee Chen. Nicolas Rojas Rodriguez. Marisabel Sanchez. Lily Shearer. Megan Tribetti. Jessica Swee. And Wei Yu Wu. Congratulations and welcome to the students of the Yaros House. Huge congratulations, students. We are so excited for each of you. I now ask, a few last instructions, there may be a couple more instructions before we end. I ask the students that you each stand and turn and face the audience. Now let's have a round of applause for these students. All right, students, you may be seated. Within the profession, it is a long-standing tradition that we make a formal promise, an oath, upon assuming the physician's role. While you are not yet physicians, we know that through your dedication in your first 2 years of medical school, and then your transition to full-time clinical environment, that you are obligated to respect its principles and ideals. Dean Amanda Osta is the Associate Dean for Medical Education and Professor of Clinical Pediatrics and Internal Medicine. I will now ask her to come forward and administer the oath.
Thank you so much, Dean Thompson. We could not be more thrilled to welcome each of you to this College of Medicine. Congratulations to each of you and your family. The University of Illinois College of Medicine now asks, as you receive your white coat, to pledge the following commitments to your peers, your instructors, your patients, and the profession. I urge you to think upon the meaning and significance of this oath as you join me in vowing to uphold its tenets. At this time, I ask that all the students, as you are able, to please stand and recite the medical student oath. Please read with me in unison as we recite this oath. I commit myself to the responsibilities of the medical profession while recognizing its challenges and privileges. I pledge to remain steadfast in my dedication to a lifetime of learning, practicing, and advancing the art and science of medicine, even in times of change and hardship. I vow that my patient will always be my priority as I strive to promote their holistic well-being and quality of life through education, prevention, and care. I will serve my patients with empathy, compassion, and humility. I will appreciate each patient's narrative, protect their privacy, and respect their autonomy. I promise to care for myself so that I may best care for others. I will foster my mental, spiritual, and physical well-being. I pledge to respect interdisciplinarity and collaborate with other healthcare professionals to provide the highest standard of care. I will advocate for equitable and evidence-based healthcare. I will be cognizant of my biases and hold myself accountable to society and for the trust placed in me. I promise to acknowledge historic injustices, to strive to dismantle persistent disparities in our healthcare system. I aspire to have the courage to advocate for my patients and seek to empower others to challenge existing inequities. I acknowledge my debt of gratitude from my patients, colleagues, and mentors from who I will learn. I am humbled by the opportunity to become a physician, appreciative of those who support me, and look forward to mentoring future generations. May this class hold fast to the ideals and passions with which we take this pledge. This oath I make freely and upon my honor. You can now sit down. I would like now to proceed to another part of our white coat ceremony, the family, friend, faculty, and friends oath. We will be reciting this oath twice, once in English and once in Spanish. Assistant Dean of Student Affairs, Dean Baushaberry, will lead you in our family, faculty, and friends oath in English.
Thank you so much, Dean Osta. Congratulations to all of our students. We are so proud of you. And I just want to say that the faculty is definitely dedicated to you because it's 1,000 degrees on this stage and we're riding through. Okay. Thank you. Just as we have asked our students to pledge their commitment, integrity, and respect to the profession of medicine, we now would like to provide their families, friends, and others here today to support them an opportunity to pledge their commitment to the success of these students and their respect for the journey they are beginning today. As many of our speakers have said, the road to becoming a doctor is not easy. The family, friends, and loved ones that are here today have helped these students get this far, and they will need your continued support throughout the rest of medical school to help ensure their success. Members of the audience, please rise if you are able, and join me in the recitation of the Family, Faculty, and Friends Oath, which is projected on the screens. We will say the oath together. Ready? Okay. We solemnly swear to be a source of encouragement for the class of 2028 of the University of Illinois College of Medicine, recognizing that this will be a critical period in their professional formation. We will give them the respect and consideration that they will need as students of medicine. We will help them to carry out their studies with conscience and dignity. We acknowledge the sacrifices that will be required and pledge our support. As parents, family, friends, and teachers, we make these promises enthusiastically and without reservation. Thank you all. Please be seated. Now I would like to welcome Dr. Gina Walton to the stage to recite the Family, Faculty, and Friends Oath in Spanish.
Hola, buenas tardes. Buenas tardes. Bienvenidos a todos. Muchas gracias por estar aquí y ser parte de este momento tan crucial en la vida de todos estos estudiantes. El hecho de que hayan venido habla muy bien de ustedes, porque para nosotros significa que han estado siempre presentes en este largo camino de preparación y formación para el futuro de todos ellos. Sé que lo han dado todo y por eso están aquí. Y aún así, les vamos a pedir algo más. El camino para ser médico no es nada fácil. Y así como les hemos pedido a nuestros estudiantes que se comprometan, que se integran y que representen la profesión de la medicina con dignidad, ahora nos gustaría darles a ustedes, familiares, amigos y a todos los presentes hoy, la oportunidad de también ser parte de este compromiso trascendental que es el servicio a los demás. Miembros de la audiencia, aquellos que puedan, por favor, pónganse de pie, please stand together, y únanse a mí en la recitación del juramento de la familia, facultad y amigos que se proyectan en las pantallas. Recitémoslos todos juntos. We'll recite it all together. Solemnemente juramos ser una fuente de motivación para la clase de 2028 de la Escuela de Medicina de la Universidad de Illinois, reconociendo que este será un periodo crítico para su formación profesional. Les brindaremos todo el respeto y consideración que necesitan como estudiantes de medicina. Les ayudaremos a llevar a cabo sus estudios con conciencia y dignidad. Reconocemos los sacrificios que serán necesarios y les juramos nuestro apoyo. Como padres, familias, amigos y profesores, hacemos estas promesas con entusiasmo y sin reservas. Gracias. Gracias. Pueden tomar asiento. Please be seated.
Thank you so much, Dr. Walton and Dr. Boucher-Berry. So this concludes our ceremony. We want to once again thank each and every one of you for being with us, including those on the live stream. And special thanks to the Office of Student Affairs staff and Office of Curricular Affairs staff for organizing this year's event. Please stand. We will not have a student recessional, but please do allow the platform party to recess before you find your student to personally congratulate them. And then one final word as we see before us the future of the medical profession. I hope every one of you will leave the auditorium with great pride in your accomplishments to date, as well as great aspirations for the future, and that those of you who love and support them will also leave here with pride, not only on their behalf, but also in recognition of all that you have done to bring them to this point on your journey. So everyone have a wonderful, wonderful weekend. Thank you very much.